February is National Children's Dental Health Month, and we're talking healthy smiles today. Joining us is Jenee from Omni Family Health to share some easy tips for kids, parents, and how making dental visits can help build smiles that last a lifetime. Hello.
Hi, Kate. How are you?
Doing good. How are you today?
I'm great, thank you.
Is this a big month for you? We're talking healthy smiles all month long?
Absolutely. February is Children's Dental Health Month, so it's a big important month for us.
Well, let's talk about why it's important to remind families that, the importance of regular dental care for both our kids and adults.
Why it's so important? Mm-hmm. Because your teeth are connected to your entire body.
The whole thing.
Yes, and when you have a toothache, it is very painful. It's right in the middle of your head. And it's the first thing, the last thing you're going to think of when you wake up in the morning, and the best way we can eliminate that is to prevent it.
Now, let's talk about how good oral health connects to our overall health. And honestly, the more I've learned about this topic, I think I'm shocked that dental isn't always included. Like, it's not part of healthcare because it's so intertwined in so many parts of our bodies.
Absolutely. Every single tooth has its own little blood supply, its own little nerve, and every tooth drains right into your jugular veins and into your heart. So if you have a tooth infection here or a gum infection here, it's draining right to your heart, and that's why it's linked to cardiovascular disease and many other circulatory diseases. So
delaying treatment for something like that can have some long-term effects on you.
Absolutely, and yes. Dangerous ones.
Yeah, I mean, not only the fact that we can get abscessed teeth or any kind of issues with the bone, but then that long term for our heart health, it's probably something we don't see till later in life because we weren't taking care of our teeth, huh?
Absolutely.
So for parents, let's talk about some simple but essential habits that we can build to keep our kids' teeth nice and healthy.
Essential habits. I really want parents to understand that they have to take care of themselves. If you have a cavity, your child is 3 times more likely to have a cavity as well.
Wow.
So the best thing you can do is to please take care of yourself and then worry about them.
At what age do I stop doing the mom double brush? Because I feel like sometimes I do it too long and my kids are like, Mom, you don't need to brush my teeth after I brush it. But I always feel like it's good for a parent to go back in, make sure everything's covered, do a little flossing for them.
You're absolutely right. And we say that at about 8 years old, they're ready to go on their own. Because they can't even hold a pencil. How can they very well clean their teeth efficiently,
I mean, it takes practice, right? Mm-hmm. So it's good for parents to go back in and just do a little quick once over.
Absolutely, I agree.
So let's talk about the dental services that Omni Family Health offers.
We have full general services. We do extractions. We have a pediatric dentist on staff, Dr. Ronnie, and she's seeing all kids, doing all ages, and doing great work with sedation dentistry and conscious sedation dentistry.
And then we always like to remind parents that when that first tooth sprouts, you should be taking them to the dentist, right? More so to get them kind of used to going.
Absolutely, and you're growing thick, hard, strong teeth. When you take them to the dentist, we're putting fluoride on the tooth, a topical fluoride on their tooth, and it literally makes that enamel thicker, harder, stronger. And Kern County is not fluoridated water, so if you're not going to your dentist to get your fluoride, then you're not getting it.
You're missing out on it. Mm-hmm. Okay, so for families who might feel nervous about taking their little ones to the dentist, how does your team create, a welcoming experience for them?
Dentistry today is really easy. A welcoming experience is just a lot of smiles and really friendly, and we let the child kind of decide the pace. Nobody's forcing a child to do anything. It's all voluntary, open your mouth and let us look in there. And everything that we do for the little kids is a lot of brush-on therapies. It's so simple. We can stop decay if we catch it early enough with just a brush-on therapy. So it's very simple for the kids, and when you keep it simple like that, they stay happy and they don't mind coming back.
Yeah, and when you make it a habit, because they should be getting their teeth checked very regularly, it's just, we're just going to the dentist, easy.
Exactly.
The little toy at the end doesn't hurt either.
Mm-hmm. Yes.
So if someone wants to reach out and make an appointment, how do they do that?
You just call the number on the screen and somebody will answer the phone and get you right in.
Amazing. Okay, well, thank you so much for giving us a little knowledge in children's dental health. I appreciate you.
Thank you so much.
All right, with that, we're going to take a short break, but we'll be right back.